One data breach in a medical center costs more than your entire annual revenue. The average cost of a healthcare data breach in the United States is $10.9 million. That's not legal fees alone. That's breach notification cost, regulatory fines, operational disruption, reputational damage, and patient trust that takes years to rebuild if it comes back at all. And there's the part that most medical centers don't fully understand when they start evaluating AI systems. When AI is involved in handling patient data without proper governance, the liability doesn't just sit with your vendor, it sits with you. As the covered entity under HIPAA, you are responsible for every system that touches your patient's protected health information, regardless of who built it. I am Dan Pereira. This is AI for Medical Centers, and today in episode 3, we are covering the governance and HIPAA framework that every medical center must have in place before deploying any AI system that touches patient data. This is the episode that separates responsible AI implementation from reckless AI adaptation. Let me start with what protected health information actually means in the context of AI deployment. Under HIPAA, protected health information, PHI, includes any information that can be used to identify a patient and relates to their health condition, health provision, or payment for health care. In the context of an AI booking and patient management system that includes patient names, dates of birth, contact details, insurance information, appointment details, procedure types, referral information, and any clinical notes captured during patient interactions. Every single touch point in your booking workflow touches PHI. Every inbound call, every booking confirmation, every reminder message, every rescheduling interaction, every piece of patient data your AI system captures, processes, stores, or transmits is subject to HIPAA requirements. This is not a technicality, this is the legal framework your entire AI deployment sits within. Here are the 6 governance components we built into every healthcare AI implementation. Non-negotiable, architected from day one. First, encryption. All patient data must be encrypted in transit and at rest. When your AI system captures a patient details during a booking interaction, that data must be encrypted the moment it's captured and remain encrypted in storage. Any transmission of patient data between systems, between your AI booking agent and your practice management system, between your system and any third-party integration, must be encrypted end-to-end, no exceptions. Second, role-based access controls. Not everyone in your organization needs access to every piece of patient data. Your AI system should operate within minimum necessary access. It accesses only the data required to perform its specific function. Your front desk staff should have access to booking and scheduling data. Your practitioners should have access to clinical records. Your administrators should have access to billing information. Proper role-based access controls ensure that a breach in one area of your system doesn't expose your entire patient database. Third, full audit trails. Every patient interaction your AI system handles must be logged. What data was accessed, when it was accessed, by what system or user, for what purpose, what action was taken. This audit trail is not optional. It is what protects you in the event of a compliance investigation, a patient complaint, or a regulatory audit. If your AI vendor cannot show you a complete, clean audit trail of every patient interaction, that is a red flag you cannot ignore. Fourth, data retention policies. How long does your AI system retain patient interaction data? Where is it stored? What happened to it after the retention period expires? Under HIPAA, medical records must be retained for a minimum of 6 years from the date of creation or the date they were last in effect. Your AI system's data retention policies must align with these requirements and with any additional state-level requirements that apply to your jurisdiction. For our clients in Europe, GDPR adds another layer. Data minimization principles, right to erasure, and explicit consent requirements must all be addressed. Fifth, business associate agreements. Under HIPAA, any vendor whose system touches your patient's protected health information is a business associate. You are legally required to have a signed business associate agreement, a BAA, with every one of them. This agreement establishes the vendor's obligation to protect your patient's data and their liability in the event of a breach. If an AI vendor is not willing to sign a BAA, they are not HIPAA compliant and you cannot deploy their system in your medical center. Sixth, incident response protocols. What happens if something goes wrong? Every healthcare AI implementation must have a defined incident response protocol. How a potential breach is detected, how it is contained, how affected patients are notified, how regulators are informed, and how the system is reviewed and remediated. Under HIPAA, covered entities must notify affected individuals within 60 days of discovering a breach. Having a clear, tested incident response protocol is not just good practice, it is a regulatory requirement. Now let me tell you what this looks like in practice for our implementations. Before we write a single line of configuration for a medical center client, we conduct a full data flow audit. We map every patient touchpoint. Every place patient data is captured, processed, stored, or transmitted. We identify every system that touches the data. We review existing compliance, posture, and we design the AI system architecture specifically around the compliance requirements that apply to that client's jurisdiction, patient population, and operational context. Every implementation we deliver includes a signed BAA, a full encryption architecture, role-based access controls configured to the client's organizational structure, complete audit logging, a data retention policy aligned to regulatory requirements, and a documented incident response protocol. That's not a premium add-on. That's a baseline standard for every healthcare AI implementation we deliver. Because in healthcare, cutting corners on governance doesn't just create operational risk. It creates legal, financial, and reputational risk that can end the practice. Here's what I want you to take away from this episode. If you are evaluating any AI system for your medical center, any vendor, any platform, any solution, ask them 5 questions before you go any further. Can you provide a signed business associate agreement? How is patient data encrypted in transit and at rest? What does your audit trail capture and how do I access it? What are your data retention policies? And what is your incident response protocol in the event of a breach? If they can't answer all 5 questions clearly and in detail, walk away. Because the risk of deploying a non-compliant AI system in a healthcare environment is not a risk worth taking. Tomorrow in episode 4, we are bringing everything together. The full ROI breakdown from a real implementation. The time saved, revenue recovered, cost of implementation versus return, and what the 90-day picture looks like after deployment. Book your free consultation at jxtech.ai. Let's make sure your AI implementation is built on the right foundation from day one.